Hi there, Dr. Leslie Masters from Masters MD. Today we're going to talk about the last two ways that we age, and what I think are the two main ways that we age. That's loss of volume and gravity. The natural way that the face ages, we lose volume and everything falls. Our goal is pick it up and fill it up. Loss of volume. What I mean by this is this. The fat in the face is unique in that as we age, those fat pads shrink or they atrophy. And we get sort of this sunken in, hangy look. Areas that are volume loss. Right here, we get the little pull down at the corner of the mouth. That's volume. If I would add fat right here, I can get the corners of the mouth to come back up. Right here, the nasolabial fold, we all think of that. That's one of the first areas to go. But if I would put fat in there, you're gonna look like this. It's that chipmunk look. To fix this line, I put fat out here and pull that line out. Every week, I have somebody come in and say, can you get this fat out? Can you get that bag out from under my eye? My answer to them, of course, jokingly, is, you didn't grow new fat under your eye. That sounds silly. What happens is we lose fat below it in the tear trough and get sort of the illusion of a bag. Those of us that don't get a bag under the eye, well, we just hollow out and get this dark scallop. Solution's the same. Drop, drop, drop. Replace the fat under the eye, and that under eye will smooth out. What I want you to realize is it's not normal to have a line under the eye, a scallop under the eye. If you look at a young person, that under eye will go right into the cheek. It should be one smooth, continuous movement. We get older looking eyes, tired looking eyes when we start to scallop out. Right here, we're born with a good fat pad under the eyebrow. And as we age, little by little, that eyebrow will start to rest on bone. And then we feel like we grew new skin in the eyelid. You didn't grow new skin in your eyelid. If I would replace fat right here, it's going to give you a little bit of a lift. The big area right here. Did you ever notice as you age, you can start to knock on this bone? Well, we didn't try it when we were 20, but you couldn't. You had a fat pad there. If I would put fat in right here, it's going to lift the whole thing up. What I want you to think of is this. Think of fat as scaffolding. It's the scaffolding, and your skin just lays nice and lovely over the top. As that scaffolding starts to break down, as it does when we age, there's no support for that skin. But if I would put the scaffolding back in, I can lift it all back up. We don't grow new skin in our face. We don't grow new fat under the eye. What happens is the same amount of skin is there, it just doesn't have the same support. There are two main ways to replace volume. One, we can use synthetic fillers, Restylane, Juvederm, Radiant, Sculptra. There's a lot on the market. What I do 95% of the time is I'll use your own fat. Typically what we do is we get a little fat, usually off the tummy, wash it, process it, purify it, and use your own fat to replace volume. Now I like to use fat for a few reasons. One, it's you. You is always better than not you. I don't like the idea of a lot of synthetic being injected into me or anybody else. Two, your own fat is living tissue. It'll just die and go away unless it gets a blood supply, nutrients, oxygen, but then it'll just live on with you. Your own fat is going to last you about 3 to 5 years, whereas synthetic fillers are going to last us more like 12 months, sometimes 18. The main reason that I like to use your own fat is this. When I look at you, I want to treat your face as one thing. That's what people recognize, that's what you see in pictures, that's what you see in the mirror. I can pick people out of a crowd who've had filler put in one area. It's that something's not quite right look. Something, this looks younger, this doesn't. It makes you look different. When I use fat, I have plenty of it. Everybody laughs at that every time. But I can use as much as I want. I don't have to charge for every drop I put in. And I can replace the volume from here to here, just exactly like you lost it. It's a soft, subtle, seamless you 10 years ago look. Nobody is going to walk by and go, oh my word, what did you do? You look rested. You look like you feel good. You look like you're taking care of yourself. It is you 10 years ago. That's our goal with all of these anti-aging cosmetic treatments. How can we keep you looking like you, but good for you? I'm 50. I'm fine being 50. I just want to look good for 50. When I say it's a you 10 years ago look, well, that's where we got the name of this final treatment I want to talk to you about. This treatment's called Me Minus 10, and it's exactly that. It's me minus 10 years. Like I said earlier, in the natural aging process, what we do is we lose volume and everything falls. What Me Minus 10 does is lift you up and fill you up. You're gonna like this, or maybe you're gonna hate it. It was Leonardo da Vinci that came up with this idea that he called the triangle of beauty. This is the base and the points down here. And if you look at the Mona Lisa, the Last Supper, anything he painted, all of his characters have these perfect triangles. If you look at a young person, boom, right to their eyes, because that's the base of the triangle. Well, what happens as we age, as we lose volume, and then gravity grabs, is this. The triangle flips. Pretty soon, this is the base and the points up top. We have more under here. We get a little bit of a jowl. We have the pull down. The lips get smaller, and this becomes the focus of the face. Get this, studies show that when you talk to a young person, you'll stay right at their eyes. But when you talk to an aging person, you go between their mouth and their eyes. And that's all got to do with where we're wearing the base of the triangle. Me Minus 10 does one simple thing. It flips the triangle back over. It's gonna put the focus of the face back on the eyes. The whole premise, well, let me back up. Me Minus 10 is one procedure that we do in two separate parts. Aging is mainly two parts. We lose volume and it drops. So first part, we're gonna pick it back up, put everything back where we want it. And that's the lift part, and that's how we treat gravity, which is really the fifth way that we age. Things fall, whether they're head to toes, they start to fall. The whole premise behind this little lift that we do is I take something that's mobile, I pull this, and I'm gonna anchor it to something that's not mobile, like your scalp. And you'll get a lift that looks like this. Number one, it pulls up. And when it pulls up, it'll tighten under here, get rid of the jowl, help with this little pull down. So first, we're gonna pull up. Second, it's gonna pull back. When it pulls back, it'll soften this line, get rid of the little scallop. Third thing it does is just tip up the corner of the eye, give you a little lift in the brow. Now how this procedure goes, you come in. We can give you some sedation to make it easier, Valium type medicine to help you relax, or you can take nothing and you can drive yourself home. First thing I'm gonna do is I mark several spots back here in the hairline. And then we tie your hair up in a bunch of little tiny ponytails so we don't cut or shave any hair. Go into the operating suite. First thing we do is make it so you don't feel anything. I'm gonna numb up the whole area. And then way back here, I make a tiny incision. The incision's about as wide as the tip of my little fingernail, so it is tiny. But from that incision, everything I do is under the skin, and everything I do is from here back. I don't cut any skin on your face. I don't cross the plane of your face. Most importantly, I don't leave anything in your face. Now this is my lift. There's no one else that does it. We used to call it the Cosmo lift. Now we call it Me Minus 10. I actually went to training, learned to do some of these mini lifts that are out there in the market. Every single one of them would leave a wire down the face, a little hammock under here, and I encourage you, don't do that. I wouldn't let someone do it to me. It's just not a good idea. Things go wrong and things can go wrong. What we do in this lift is with a surgical suture that will dissolve. I'll go in up here and I grab these points in a characteristic way. I'll pull that suture under the muscle and tie it in a knot. Then we sit you up, we take pictures of you half pulled and half not pulled, lay you down, do the other side. When we're done, I'm gonna put a little pad on each side and we wrap some specialized bands just to hold it all real still for a while. At that point, I'll give you your before and after pictures to take with you, and you're good to go. Now, about 3 hours later, this numbing is gonna wear off, and you can be kind of tender there for about 24 hours. I'll give you pain pills. Some people use them, some people don't. At about 48 hours, it's tender, it's starting to feel more like a bruise. We see you back at 1 week and take one little stitch out of each side. That's what we do for Gravity. We see you back at 2 weeks. We'll get a little fat, like I said, usually off the tummy, process it and re-inject it, and now we've treated volume loss. Me minus 10. It's lift it back up and fill it back up. That's the best way to treat loss of volume and gravity. I hope you'll join us for some more. Thank you.